Hi everybody, this is Rich Tran, back again once again. We're going to study Jose Trejo with PTSD, post-traumatic stress disorder. The therapist's name is Rich Tran. Okay, Jose's profile. His name is Jose Trejo. He's also known as Smooth Operator by his buddies. And he doesn't want his picture to be posted here. He's 35 years old, Hispanic male, 12 years military veteran. He's married with no children, has multiple tours of duty in Iraq and Afghanistan. He's unemployed due to his PTSD symptoms. Can't keep a job. When Jose first came to me for therapy, he said these to me. I couldn't get those images on my head. There were lots of them, but one in particular, a young child who'd been mutilated but left alive, came back to me over and over again at night and during the daytime. Pictures jumping into his mind, within my mind during the day, nightmares at night. I was short-tempered and on edge, shouting at my wife, losing my cool with others. Couldn't think straight, just wanted to lock myself away and draw the curtains. I was losing my mind. I thought. That's what that's his exact statements were. Further PTSD symptoms and complications. Jose is irritable almost all the time. He has insomnia. He lashes out at others. Finally, his wife had enough and tells him to see the counselor. She couldn't stand him anymore. Available treatments for Jose there are quite many. The complications and disabilities associated with prolonged PTSD may be prevented by initiating assessment and treatment quickly after the traumatic event, well before a diagnosis of PTSD can be made. Treatment is often best accomplished with a combination of pharmacological and non-pharmacological therapies. Medication may be required to control the physiological symptoms, which can enable the patient to tolerate and work through the highly emotional material in psychotherapy. Treatment is often complicated by comorbid disorders, which has presence of alcohol abuse or substance abuse, and those problems should be the main focus of the treatment if it is comorbid. In the presence of coexisting depression, treatment should focus on PTSD because it's the course biology and the treatment response are unlike those associated with major depression, which is more serious. PTSD more serious. Treatment consists of group therapy, individual, family therapy, cognitive behavioral therapy, play therapy, art therapy, anxiety management, eye movement desensitization and reprocessing, hypnosis and relaxation techniques. Furthermore, with therapies for PTSD, let's look at prolonged exposure therapy, which is quite successful according to research. This treatment focuses on the body's physical stress reactions like racing heartbeat, sweating, nervous feelings, tensions, along with ways to control these reactions. You and your therapist will identify situations where you feel those reactions inappropriately, such as in a crowded shopping mall or at the rifle range. You'll then expose yourself to these stressful environments armed with skills that help you relax and manage stress. Jose at first did not like the therapy, getting exposed to those fears again, but with medication that helped him, so he's taking baby steps, increasing stimuli every therapy session, and he's doing a good job. Therapy exposure continued. With time and practice, stress-related reactions will diminish, and you'll be able to function better in everyday life. There are two reasons why this works. First, you have learned how to consciously control your reactions to stressful memories, a skill that comes in handy in many situations. Second, as you become more exposed to stressful conditions, your body will naturally start to change its reaction. Imaginal exposure, in vivo exposure, which is live exposure, and virtual reality headset Jose chose to use the VR headset because he said it was more like a video game, which he enjoys playing video game when he's not having symptoms of PTSD. Once again, furthermore, different types of therapy techniques: psychodynamic trauma-focused treatment, which is cognitive processing therapy, examine thoughts and feelings related to the traumatic events, how it changed one's thinking. For example, many people with combat experience may start to think that the world in general is a bad place. This thought will understandably lead to negative moods and attitudes toward the world, oneself, and others. The goal is to replace this faulty thought with another, more realistic thought, like certain places, parts of the world, certain people are bad, but there are lots of good places and good people in the world. Right now, I'm in a good place. This works because there's a very strong connection between one's thoughts and moods, mind-body connection once again. When you identify and challenge thoughts, feelings associated with poor moods will usually change. Furthermore, with therapy, hypnotherapy, hypnosis. Usually the therapist identifies the trigger of PTSD, the therapist installs powerful stress reduction techniques to the subconscious by suggesting reprogramming of the subconscious to a positive outlook, more positive when looking at the stimuli. Jose did not like this option, said he does not want to be mind controlled by anyone. Another therapy is eye movement desensitization reprocessing therapy, or EMDR. EMDR has been successful in helping the survivors of various traumas such as domestic violence, sexual abuse, crime, and combat. The method involves psychotherapy that combines various therapeutic approaches with eye movements or other types of rhythmic simulations to simulate the brain's information processing mechanisms. Yeah, Jose, and once again, VR is kind of EMDR headset with cognitive processing therapy. It's used to rewire the brain or way of thinking with the stimuli with the environment. Looking at the pharmacological treatments, the drug option, which I would do last as a last resort if it's extreme cases of homicidal or suicidal. We use this. Selective serotonin reuptake inhibitors. These are a class of medications initially used to treat depression, but two medications in particular is approved by the FDA for PTSD treatment. Includes Paxil and Zoloft. These medications work by allowing your brain to use a certain neurotransmitter called serotonin more effectively. Serotonin has been linked to anxiety, which is a core symptom of PTSD. So which treatment is best? That really depends on the person. And some people respond very well to one treatment and some others not well to. Some people use a combination of medication and psychotherapy. I would recommend myself psychotherapy first. Extreme cases use medication to control the anxiety. Medications usually have to be taken for a year or longer, while the therapy usually takes 8 to 12 sessions, with 1 session per week. In extreme cases, the therapist may prescribe a drug cocktail, which includes apiprazole and other, and the cognitive behavior therapy, or sertraline. The therapeutic cocktail was observed to reduce the recurrence of hyperarousal episodes, which is the predominant symptom of PTSD. Jose is currently taking Paxil to calm him down, to relieve his anxiety, and Ambien to help him sleep with his insomnia. Jose says he has no major side effects such as dizziness, drowsiness, confusion, difficulty concentrating while on these 2 drug combinations, which is good. The VA, or the Department of Defense, has also a PTSD hotline, which is called Veterans Crisis Line, which is open 24/7, provides immediate access to mental health crisis intervention and support. The number is 1-800-273-TALK. The number is 1-800-273-8255. Press 1. You'll be immediately transferred to a person who is an expert in PTSD. Other complications and treatment barriers. Usually it's with the patient and the therapist. Complications include increase in re-experiencing the event that caused the trauma, avoidance or arousal symptoms, dissociation, substance abuse, dependence like alcohol and drugs to numb the pain, whatnot, overwhelming anxiety, numbing, self-injury, suicidality, homicidality, desire to drop out of therapy, which is pretty common when the pain is too much. Physical aggression by patient, relationship problems, worsening of the therapeutic alliance, which is the family members getting upset, and the therapist and the client getting upset together. Depression, severe anger, physical aggression by others to patients. Once again, that's important too. The other patients or other people are angry at them. They have low social support, which could cause them to drop out. Don't want to maintain the therapy. Past adherence problems, past treatment non-response problems. Usually when the person has tried a treatment before and has failed, so it has ingrained in them that said usually tells them that it's not going to work. So we had to try to change the behavior of the person or convince them to try it again. And the obstacles to information in unsuccessful cases include psychiatric comorbidity, which is a double case of alcohol and drug abuse along with the symptoms. Task problems, homework problems, don't want to do the homework at home or exercise at home, patient refusal, and medical contraindications, where some drugs can mess up a person really bad, especially when you mix a couple of drugs together, so you gotta be careful. So talk to your doctor which ones are okay to take, which combinations are okay to take. Drugs have a synergistic effect, which compounds the effect of the drugs, which could cause suicidal thoughts or even homicidal thoughts. That's very bad. Jose here said he has majority of the symptoms, but since he's on medication, he's been able to control them, and with therapy has really helped him a lot. And sometimes patients need inpatient care. Patient care is necessary only if the patient becomes suicidal or homicidal. If complicating comorbid conditions like alcohol, downward spiral, drugs, requiring inpatient treatment, depression, substance abuse are present. So you gotta treat whatever the abuse of drugs or alcohol first if the patient is experiencing that. Jose here had fortunately had only one major episode where he was sent to the hospital. That was when he forgot to take his medication. He was only in there a couple of days and was out. Long-term monitoring for PTSD is important overall because it could have relapse of the symptoms again if not careful. Having experienced trauma, some patients with PTSD may socially uncomfortable. Encourage them over time by helping them to keep them therapeutically engaged, which yields optimal medical and psychiatric benefits. So help them support them. Jose luckily has a wide area network of his friends and family and combat buddies in his unit helping him, encouraging him to stay with the therapy. A lot of patients don't have that luckily family support, or good family support that is. There are various mobile apps provided by the Department of Defense, created specifically for PTSD. CBTI Coach is a mobile app designed to use by people who are having difficulty sleeping and participating in cognitive behavior therapy for insomnia, guided by a healthcare professional. There's another app called Mindfulness Coach, which provides tools to assist users in practicing mindfulness meditation, which is controlling your breathing, being aware of your body functions. And there's another app called ACE Act Coach for depression support. People currently participating in acceptance commitment therapy who want to use an app in conjunction with their therapist to bring ACT practice to daily life. Jose regularly uses the CBTI Coach app when he's not in therapy to remind him. Okay, the snapshot of summary of Jose. Once again, he has continued treatment with therapist with Tran along with the VA doctor. His therapist has given some mindfulness coaching with him. He's been doing meditative practice, so he's been able to keep him calm. He has been taking Paxil for his anxiety, and he's been using the VR virtual reality headset exposure therapy, which he likes very much, along with cognitive processing therapy. You retrain his brain. He's halfway into his 12 sessions. He has showed major improvements in controlling his outbursts and anxiety. He is decreasing his dosage of Ambien regularly each night. And most importantly, he has less fights with his wife. He regularly uses the CBTI Coach app. Here are the references if you want further information on PTSD. Department of Defense, VA has a lot of good information. So that's it. Thank you for watching. I hope you enjoyed it.